Alrighty, so if we do have a client that does have arthritis, we need to make sure that we do have a doctor's clearance and that we do understand the extent of their arthritis. We need to explain to them that resistance training does offer numerous benefits to help someone manage their arthritis, explaining that it keeps their joints strong, lubricates their joints, and also decreases bone loss. It helps control joint swelling and pain. We always need to make sure our client is not in any pain during the session and that we start off slow and easy, building up as we learn the client's limitations. We always need to make sure that the warm-up and the cool-down do play a major role in the session to make sure that we do ease the joints into it. So before we start training a client that has hypertension for a strength program, we do need to make sure that we have a doctor's clearance and that we understand the full condition of the client's condition. We need to be patient and start slow with our client, gradually increasing. We need to consider any barriers that could affect their consistency, develop strategies to assist in eliminating these barriers. We need to make sure our client is always breathing throughout the session, as this could cause large fluctuations in blood pressure, which could increase the potential to pass out or possibly result in life-threatening abnormal heart rhythms. We always want to make sure that our client has a high rep range of 12 to 15 and an easy weight limit, and that they're continuously moving throughout the session and not lifting at a high maximum effort. We want to make sure that our client always warms up and cools down at a good pace before and after our session for a decent period of time. Alrighty, so if we have a client that does have an asthma problem, we need to remember to always receive a clearance from their doctor and to make sure that their day-to-day asthma is managed already. We need to make sure that they always carry their asthma reliever with them to all the training sessions. We also need to make sure that the area that they are training in is clear from all dust, because that can trigger an asthma attack. When we start the session, we need to make sure that they do warm up for at least 10 to 15 minutes at a slow, easy pace, and to stretch before they start the session to stop any asthma from starting straight away. So yeah, that's about it. And they always need to remember to cool down after their session. Alright, thank you. Alright, so before my client has come, I've called to confirm that she's coming in still. Before she's gotten here, I've made sure to remove all hazards from the area. I've also checked with the other trainers to make sure that the area is free. I've done a routine check of all the equipment for any faults that could be there and to make sure that there aren't any heavy weights. And I've also checked that the assessment room is free.
Action.
Hi Jacqueline, my name is Sally. Thank you for coming in today. I'm your personal trainer. So I see here you've filled out in our screening test that you don't suffer from any previous injuries, that your blood pressure's fine.
Yeah.
And you have no medical issues that I should be concerned about?
No.
Awesome. Alright, so today I'm just going to be taking you through a PT session. I'm just going to take you through and show you how to use some of the equipment outside to make sure that you don't cause any injury to yourself. Does that sound good?
Yeah, it's great.
Awesome. Is that alright? Alright, so I'm going to start off with a warm-up on the treadmill today. One of the safety features of a treadmill is this, so that just hooks on there. And that's so if you do need to suddenly stop, it does pull the emergency release. So when we're on a treadmill, we want to start off with an easy pace. So we'll start off on about a 5, just for a warm-up. When we're on the treadmill, we want to make sure that we have our shoulder blades together, our core contracted, and we just start off nice and easy. Then when you feel ready, you move up towards a faster pace, just using the upper arrow. Alright, so I'll get you ready to go. Yep, so we just hit the emergency stop to release it. And start. Right, so just for a warm up, we'll put it on a 5. And then we have our shoulder blades together, chest out nice and proud. Cool. So when we do a step up, we'll start off leading with our left leg. We start into the center and up. And back down with the leg that you lead with. Up. Down. So I almost imagine that you're being pulled up by a string. Back straight. And down. And then if you want to make it harder, you can add in a bit of a jog. So up, down, up, down, up, down. Or you can even elevate it and make it higher. Try that for me? Alright, thank you. Yeah, back nice and straight, chest forward. Remembering to breathe as we move. That's perfect. Alright, thank you. Awesome. Alright, Jacqueline, so today I'm going to take you through on how to do a push-up. So there's two different variations you can do. You can do them on your knees or you can do them with your feet out. So I'll take you through the ones on your knees first. We always want to remember shoulder blades together, abs contracted. So we want our hands to be just shoulder width apart. Knees back. And remember, we breathe. We go. Breathe in as we go down. Out as we go up. Head forward, shoulder blades together. So now I'll show you the full push-up. So again, hands just about shoulder width apart, feet together. Head forward, remember to breathe. We go. If you'd like to give that a go. Did you understand?
Yeah, I think so. So that's right with hands?
Yep, hands are perfect. Remember shoulder blades together, head forward, and to breathe in as we go down and out as we go up. Perfect.
On feet as well?
Yep.
Yeah.
Perfect. Alright, so I'll get you to perform a squat for me.
Yep.
So just remember, feet in a comfortable position, feet slightly outwards.
Yep.
Backs together, abs contracted.
Yep.
And remember to breathe. Yep.
So in,
We breathe in as we go
In and
down,
out.
yep, and then out as we go up. Yeah. Yep, no, that's great. Yep, keep going for me. Yep, try and remember to keep your back contracted. Chin slightly up. Perfect.